Hello, I'm Angela Monroe, and I am one of the bariatric coordinators with Mid-Michigan Health's Surgical Weight Management Program. When considering bariatric surgery, it's important to understand your surgical options. Listen to one of our bariatric surgeons discuss the Roux-en-Y gastric bypass option.
Next, I'll talk about the Roux-en-Y gastric bypass. So again, on the diagram on the right-hand side, for the gastric bypass, the upper part of the stomach is cut into a small pouch. Typically holds about 1 to 2 ounces of fluid. So food comes down, and then the small intestines are divided and connected to that pouch. So food will come down the esophagus and it'll stop in the pouch, and then it will empty into the small intestine here. And it's not until things meet up right here that your body starts to absorb those calories. So this works not only by restriction, but also malabsorption, because your body's not going to absorb everything that's taken in. Early studies of the gastric bypass were quite successful, showing about a 75% excess weight loss for patients. Complications with the gastric bypass, there is a risk of intestinal leakage. So anywhere we cut, divide, or reconnect the stomach or small intestine, there is a risk that those connections won't heal appropriately. And so patients can leak intestinal contents if that were to occur. Fortunately, it's not a very common occurrence, but if it does happen, somebody can become quite sick. So you'll see for all these surgeries, we do have a very structured diet regimen after surgery, partly to allow these areas to heal up appropriately and not have any breakdown or leakage. There's something called acute gastric remnant dilation. So after a gastric bypass, this is now the remnant stomach over here. And sometimes that part of the stomach's a little bit slow to awaken after surgery. So a patient that experiences this can have a sensation of nausea, but there's no easy way to relieve that if you were to try and vomit, okay? It can feel almost like you just have a lot of bloating. And so the good news is most of the time this is just temporary, and usually within the first 48 hours it does resolve. There's also a risk of obstruction where the intestines can become blocked. And that's something that can be seen because of the rerouting of the intestines. It's not often seen early after surgery, but actually later, because as patients are successful and lose weight, there are areas where fat tends to fill in these spaces behind the intestines. And when these patients have gone on to lose weight, you have a small space that has now become a larger space and can allow the intestines to kind of become twisted around themselves. Nausea and vomiting, again, as I mentioned, anytime we do surgery on the stomach, that's kind of how the body will respond to that stress. Any organs in the area that we're working also can become injured. So the spleen, which kind of lives right up over here by the stomach, can certainly become injured. The stomach or the esophagus itself could be injured as well. There are also risks of cardiopulmonary complications, such as an MI or a heart attack, what's called a PE or pulmonary embolism. This can occur if somebody were to form blood clots in their legs and those clots broke off and traveled to the lungs. PEs can be fatal, so we do take them very seriously. So we want to do everything we can to prevent them from happening. Next, I'll talk about something called dumping syndrome, which is seen primarily in patients with a gastric bypass. Some people consider this a complication. Other people consider it a reinforcement, okay? A reinforcement because it typically happens if somebody eats a very high sugary or carbohydrate food, things that often we're recommending you avoid after surgery. So what happens is that food stuff comes into the pouch and then will empty quickly into the small intestine. And because of the high carbohydrates, it pulls a lot of fluid into the small intestine. And so when somebody experiences dumping syndrome, they can feel like their heart is racing, they can break out in a sweat, they can feel sick to their stomach or vomit, they can have diarrhea. They feel pretty miserable for about half hour, 45 minutes.
If you would like to learn about other surgical weight management options, watch the videos on sleeve gastrectomy and adjustable gastric banding.